right, good evening, everyone. Today we'll be talking about SI joint pain and what that presents with, and then some treatment options that you may consider when it comes to SI joint dysfunction and pain. Just as some housekeeping things, again, please put yourselves on mute, and then at the end, we'll open it to questions and answers where you can unmute yourself. Um, this will be the last Doc Talk for the current year, and then we'll start resuming things back up next year. So, getting right into it, what is SI joint? Where is the SI joint? And, where can this present with pain? So, if you can see on the picture here, the SI joint is this little line, right here. So, it's below the lumbar spine. And so, located on your body, it's located around your lower back and your buttock area. And so, typically, pain presents in that area primarily from the fusion of two joints. So, you have the ilium, which is this big bone, and then the sacrum, which is almost a triangular shaped bone. Both of them connect to comprise what's the sacroiliac joint. And so, you can see the lumbar spine is above and then the hip joints are below. And so typically, any sort of pain, like any other joint, like your knee joint, your shoulder joint, inflammation can build up into that joint and drive pain. And so this joint itself has some movement. It doesn't have a lot of movement like your hip joint or even your lower back does, but it does have some movement. And so you can imagine any sort of altered movement into the SI joint can cause inflammation leading to pain. So, what are the common symptoms that we see when patients have some SI joint pain? So, typically it's lower back pain, often like a dull toothache, so your standard arthritic pain. That pain can be sharp, can be stabbing in nature at times. This pain typically goes in the back to the buttocks, doesn't typically go lower than the knees, so that pain that you might feel like burning, tingling down the leg is typically not your SI joint pain, right? So those are important things to differentiate that we ask you in the office of, how far does your back pain go? And so the other consideration with the SI joint pain is pain when you're going from seated to standing position. And so that movement from going from that position to a standing position cause translation in that SI joint, and that can lead to pain. In addition, lying down flat. When you lie down flat, typically that puts a lot of stress onto your SI joint, and that can lead to pain, right? So, just those are a couple of the symptoms that can mimic the SI joint pathology. Walking movement sometimes makes it feel better, right? So it's a joint. So as it starts to lubricate, as it starts to get fluid within the joint, it starts to potentially feel better. And then you find tenderness along the lower back joint line. So your belt line, right below your belt line, is typically where patients feel the most pain in that area. What are the causes? So, like we talked about, arthritis, since it's a joint, arthritis can uh, be a culprit of, be the cause, and then inflammation in the joint because of that arthritis can lead to pain. Unfortunately, trauma or fall, getting a pelvic fracture, getting an injury, that can lead to pelvic dysfunction and worsening of the arthritis over time. Pregnancy and childbirth. Females that give birth, the ligaments along the SI joint get very lax to help with delivery, and so oftentimes after delivery, those joints and ligaments have a hard time reverting back to their normal structure, and that can lead to some inflammation and pain. Previous spine or hip surgery. So we have patients that have had surgery in their back with the surgery called a lumbar fusion, and what that does is it restricts motion at that lower back segment. Right, that is the purpose of a lumbar fusion, is to restrict motion so that you don't get a lot of translation. Unfortunately, what happens, especially in that area, is that it puts a lot of the forces, and now a lot of the pain generates to the joints below. So if we go back to our image, we can see that if we fuse this area above, it's going to start to create more stress at the joints below. Similar, if we fuse or we put hardware we get a hip replacement, it's going to put stress at the joints above, right? So, back and hip surgery both have um, can accelerate SI joint pain or can be a cause of SI joint pain. And then altered mechanics, right? If you have malalignment of the back, if you have malalignment of the pelvis, your physical therapist might notice there might be some leg length discrepancy that could be shifting in that pelvis, and that could lead to some of that pain as well. So, how do we diagnose this? Well, typically we start with X-rays. We look at X-rays of your back. We can sometimes see any sclerosis or arthritis into the joint itself. MRIs and CAT scans tend to be the most sensitive in looking at inflammation. What I'm also looking at when I'm looking at an MRI is are the ligaments around the SI joint. And so typically, the joint can cause pain, but the ligaments are what's damaged or irritated, right? So, looking at the MRI, making sure that there's no ligament tears or any muscular issue can be helpful in making sure that purely this is a joint issue. And then the CAT scan, I think, is helpful in looking at the bone, checking for the arthritis, looking to see if there's any further damage to the joint that we need to be concerned about. So from a treatment option, there's quite a few treatment options that are conservative, and first line is getting the diagnosis right. And so understanding, is this truly SI joint pain? Is this not referred pain from, say, the disc, or is this not referred pain from the hip? Making sure that we know this is SI joint dysfunction, and that comes to your symptoms, that comes to the imaging. Treatment, ice, like any sort of arthritic condition, ice can help reduce the pain. We often recommend our patients trying applications of alternating ice and heat. With that being, ice reduces inflammation, heat reduces the stress in the muscles, and so that conjunction therapy can overall give you some benefit. Physical therapy, so this is very important in strengthening the muscles around the hip girdle and hip pelvis. And so you can imagine if there's a lot of micromotion at the hip, at the sacroiliac joint, the stronger the muscles are around that joint, the better your pelvis is going to be stable when you do something active. So, strengthening the core, strengthening the hip muscles, the gluteus muscles, there's three muscles in the glute. And so, really strengthening all of those can be very difficult, but that is very important in reducing those micromotions in the SI joint that could lead to pain. Uh, and then there's medication. So anti-inflammatories are the typical drugs we recommend in reducing inflammation. There are, Tylenol can be used to help with the pain. We do recommend a lot of topical rubs and things like that that can help calm down inflammation at that local environment. Chiropractor and massage and manipulation, they do definitely have a role in SI joint pain, primarily because we talked about the malalignment that can drive some of the pain. So I do send patients to chiropractors or osteopathic manipulation to help readjust the pelvis to get those back in line so it puts less stress onto those joints. Now let's talk about, what are the interventional options that we can offer if you've tried some of those conservative therapies. So first thing is conservative SI joint injections. And so we use the SI joint injections for a couple of purposes. One is we use it for diagnostic. So as you can imagine, the SI joint pain can be mimicked by so many other conditions. And so you might have back surgery, you might have disc pain, you might have hip issues. So it becomes important for us to do a diagnostic SI joint injection where what we do is under X-ray, we put medicine directly into that joint. And what we want to see is, do you get relief? Do you get any sort of pain control? Uh, Knowing that information helps us determine that how much percentage of the pain is coming from the SI joint. So you might see us order a diagnostic SI joint injection. Typically, it's used with just anesthetic alone, so you're not going to get any long-term relief from it. If you do get relief from the SI joint in diagnostic test, then we can be very confident that that's where the pain is coming from. And so Subsequently, we might do an SI joint injection, therapeutic injection, and that's where we're actually putting steroid into the joint to now control the inflammatory environment. And so that treatment can be very effective in controlling pain anywhere from 3 to 6 months, if not longer, to reduce that cascade of inflammation that you might be having. Um, the second offshoot to that is doing what's called an ablation. And so insurance coverage has changed in offering this therapy over the last year or two. But what this does is this actually burns some of the nerves around the SI joint, and that can provide some sort of long-term relief for patients. Unfortunately, I think Medicare did take this off their approval list, but we do have some patients that are self-pay that do find a benefit of getting this done. And then finally, when it comes to long-term treatment options, we do a procedure called SI joint fusion. And so SI joint fusion, basically, once we've confirmed that the joint is the pain generator, we can actually fixate the joint so it's not causing any sort of micro movement. And so, what we do here from the SI joint fusion is under X-ray, we actually put some screws into the joint along this joint line so that it fixates in place. We don't want to create that motion along the joint. So this is done as an outpatient procedure. And what we do is we do this under X-ray, where we give you some IV sedation. And what we do is we implant these three little screws that go across to the joint, fixate the joint so that limits that motion. A couple benefits of this is that patients don't have to continue to get their SI joint injections, right? So we know SI joint injections have some moderate benefit, maybe short-term benefit. We also don't want to continuously introduce steroids into the joint, which can potentially wear down the joint. So most of our patients, after they've gone through maybe 2 or 3 of these injections, having a discussion of actually treating the problem, fixating the joint, controlling that motion in the joint so that inflammation doesn't continue to happen is very important, and it's a good viable option. And so it's about a 30-minute procedure where we, again, like I said, put screws along the joint with some moderate anesthesia. And then post-operatively, you're up and ambulating. There's no immobilization or brace that you would have to wear. Usually pain resolves after about 2 to 3 weeks. And then once it's fused, it's fused. There's bone growth around it. There tends to be, no issues along the SI joint from a future therapy. Most of the studies have shown that there's been over 73% reduction in pain after fusion, with low complication rates and low reoperation rates when it comes to this procedure. So, when it comes to kind of thinking about next steps, is think about, what does your pain feel like, right? Do you have that back pain? Do you have that buttock pain? Um, have you had a history of back surgery? Have you a history of hip surgery? Are you still getting that nagging back pain? The SI joint, as we described, could be what's causing some of your symptoms. And a lot of our patients, again, initially start with that conservative therapy, but going through a diagnostic injection can be very helpful in understanding that is this a source of the pain? And then finally, depending on your response, coming up with a treatment program, including, either manipulation, massage, medications, and then some of these injections or fusion therapies can really provide you some long-term benefit, down the line. And so, that's pretty much it with regards to the discussion. Wanted to leave that open for any questions that the group might have.
Hi, this is Kelly Miller.
Yes.
You've done a couple of lower lumbar epidurals,
Hmm.
and I'm scheduled for another one. So, is it possible to do a test on the SI joint at the same time?
Not at the same time. So yeah, it sounds like you're having kind of some of the symptoms we described.
Oh, yeah.
Yeah, so I think let's see how the epidural responds to some of
Well, it always responds good,
yeah.
except for when I do anything, I can't my knee seems to be acting up more now and my feet.
Yeah. Yeah, so I think, great discussions that, I think once we treat, say, disc pain or disc herniation pain with epidurals, for example, a lot of times that will uncover some of the SI joint pain, right? So we can kind of see your progress and then discuss, do we need to do an SI joint injection to determine if that's the source of the residual pain that you might be having. But yeah, that often happens is as you treat one area, then the other areas start to say, bring, come to light a little bit more. But yeah, absolutely, that's something with that we can consider down the line. Perfect. Well, I appreciate everyone chiming in. I know it's a busy week with the holiday time, so hope everyone has a good Thanksgiving and holiday. Like I said, December we will be taking a break from the Doc Talks and resuming that next year. If you have any suggestions on topics that are interest of you, please let your provider know, or please email them at info@daytondoc.com, and we're happy to discuss some topics that might be of interest to you all. Well, again, thank you everyone for your time, and then yeah, have a good holiday, and then we will see you next year. Take care.